everyone, before we dive in our video, I would like first to acknowledge the Negros Oriental State University. This is part of our requirement in NCN 106 related learning experience in program of nursing. Welcome to my channel. The sole purpose of creating my YouTube account is for academic purpose only. Shall we start? In clinical settings, especially in post-operative ward or in medicine ward, as a student nurse who isn't exposed much clinically, you might happen to encounter this type of procedure or you might assign it from your clinical instructor. This kind of procedure isn't medically new and it has been applied and continuously improved around the globe and being accepted in the CDC, which stands for Center of Disease Control, and that is the Tracheostomy Nursing Care. Any idea about this procedure? Then, let's dive in. Tracheostomy. This is an artificial opening which is surgically created by an incision made into the anterior wall of the trachea. The incision is usually made at a level between the second and fourth cartilaginous rings of the trachea. A tracheostomy, it provides an air passage to help the client breathe when the usual route for breathing is somewhat blocked or reduced. Now, let us review on the anatomy and physiology, just a quick overview. This is part of the respiratory system. It is part in our this one located in our neck area, right? The trachea, which is also called the windpipe, a cartilaginous tube that connects the larynx and the bronchi of the lungs, allowing the passage of air for us to be able to breathe. As what I have said a while ago, the incision of the tracheostomy is in between the level of second and fourth cartilaginous rings of the trachea. And this is the picture on which the tracheostomy tube is placed. There. This one. Right? It's clear, right? Now, if the patient has a tracheostomy, there is a possibility that it can be temporary or permanent, but it all depends on the condition of the patient. On the temporary tracheostomy, this one involves the opening of the surgical incision and the insertion of tracheostomy tube. The tube is then held in place by tapes secured around the patient's neck. The permanent tracheostomy involves the incision of the circumference of the trachea so that it forms a permanent stoma or opening on the surface of the skin. Next one on prognosis. Most patients require 1 to 3 days to adapt to breathing through a tracheostomy tube. It would take some time to learn how to communicate with others, but initially, it may be impossible for the patient to talk or make sounds. After training and practice, most patients can learn to talk with tracheostomy tube. Patients or any family members can learn how to take care of the tracheostomy during the hospital stay. We will not go deeper about this since our focus here is to provide tracheostomy care. Now, as for the general indication of tracheostomy, why does someone need to proceed this procedure? There are a couple of reasons why they receive a tracheostomy. One is obstruction of the mouth or breath, right? Obviously, how will us able to breathe if there's an obstruction of mouth and throat? Then, if there's an obstruction, then this person can go through a tracheostomy. Another one is difficulty in breathing caused by edema, injury, or pulmonary condition. Another reason is an inherited abnormality of the larynx or trachea. And lastly, if there's a cancer of the neck, this can affect the breathing. Now, as for the possible complication and risk, tracheostomy are generally safe, but they do have risk. Some complications are particularly likely during or shortly after surgery. Again, our focus is in performing tracheostomy, so we will not discuss about we will discuss the later complication. The later complication that may occur while the tracheostomy tube is in place include if there's an accidental removal of tracheostomy tube, which is the accidental decannulation. Take note, guys, that decannulation, this is a process whereby that a tracheostomy tube is being removed once the client is no longer needs it. So this one here is accidental decannulation. Another one is if there is infection in the trachea and around the tracheostomy tube. So why does there an infection occur? Then it has something to do with proper hygiene. Another reason is windpipe itself may become damaged for a number of reasons. There are a lot of reasons that it can damage the windpipe. Next one is the delayed complication that may result after a long-term presence of tracheostomy, which is include the thinning of the trachea from the tube rubbing against it. Another is the development of small connection from the trachea to the esophagus, which is called the tracheoesophageal fistula. Another one is the development of bumps that may need to be surgically removed around the decannulation that can occur. Narrowing or collapse of the airway above the site of the tracheostomy. Another one is once the tracheostomy tube is removed, the opening may not close on its own. Now, we are able to understand the rationale of the tracheostomy. Next, we will discuss about the equipment that are involved in the tracheostomy. On the next picture, as what you can see on the picture here, this is parts of the tracheostomy tube. The first one we're going to talk is the outer cannula. The outer cannula, it fits into a stomach to keep it open. The outer cannula has a neck plate that rests on the skin. Next is the inner cannula. This one fits inside the outer cannula. The inner cannula can be removed or cleaned. So guys, the inner cannula, this is the one that we will clean. Another one is the obturator. This is a device that guides the outer cannula into the stomach during placement of the cannula. The obturator is removed after the cannula is placed. On the next slide, as what you can see, this is the other part of the tracheostomy tube. The cuff, which is the inflatable air reservoir that helps anchor the tracheostomy tube in place and provide maximum airway sealing with the least amount of local compression. Next one is the tube shaft, which the outer and inner cannula being hold. Next is the neck flank. It is all to keep in place with the trachea string to keep it hold together. Next is the inflation line. Is a route for air. The port, pilot port with valve. This one is serves an indicator of the amount of air is in the cup. Next, the essential equipment. This type of equipment are used for performing the tracheostomy care. We have a sterile gauze sponge, the sterile cotton swab, sterile gloves, sterile water or the plain NSS, the tracheostomy tight tape, the sodium bicarbonate 2%, suction catheter, bandage scissors, forceps, pipe cleaner or gauze or swabs, and waste receptacle. Now, we able to understand and identify the equipment that are being used. We will now proceed on providing tracheostomy care. Tracheostomy care is one of the basic skills that a registered nurse should know. Learning how to do tracheostomy care is hard and complicated at first, but with proper knowledge and practice, we can able to master the skill at ease. Before performing the tracheostomy care, we should know the purpose itself. Know the purpose. First reason is to maintain the airway patency by removing the mucus and encrusted secretion. Second is to maintain cleanliness and prevent possible infection at the tracheostomy site. Third, to facilitate healing and prevent skin expiration around the tracheostomy incision. And fourth, to promote comfort and prevent any displacement. On the assessment, we should assess the respiratory status. by auscultating the breathing sounds of the lungs in the appropriate location. Another is to assess its pulse rate. Another one, the appearance of incision. We should check the stoma, inspect the consistency of color of stoma, and inspect if it's still moist and no unusual odor. Another one is the secretion from the tracheostomy site. Another is the presence of drainage of tracheostomy dressing or ties. Now, we will watch a video about performance on tracheostomy care. It is from the College of Do page. Now, please do watch it carefully. Every detail is important.
Today we're going to be performing trach care on a patient. So I have my patient chart here. Jamie Jones, MR number 589-135-1329, date of birth 1/16/62. We also want to verify that the patient has no allergies, and then we want to check the order, the physician order for the skill we're about to perform. States here, trach care suctioning every 12 hours as needed. Now we're going to go gather our supplies. We'll need a drape, suction catheter, extra pair of sterile gloves, hemostat, bandage scissors, pulse oximeter, and our trach care kit, which will have our cleaning solution, trach ties, and gauze. Now I'm going to go enter the patient's room. Knock, knock, knock. Hi, Mr. Jones. It's Sarah, your nurse. I'm here to perform trach care and suctioning. How are you today? Let's get some gloves on here. I hear some rattling in your chest there. I think that's important that we get that dunk out of you. Just gonna bring that up here. Are you having any pain or anything? Okay, good. Can you tell me your name and date of birth? Okay, we have Jamie Jones, MR 589-135-1329, date of birth 1/16/62. Okay, good. Now I'm going to just take a quick listen to you here. Take some deep breaths. Okay, and again. Again. And again. Alright. Sounds like we want to get some stuff cleared out of your chest there. I'm also going to put this thing on your finger here, the pulse ox. Let's see how your oxygen level is doing right now. Yeah, looks like we could use a little bit of suctioning. Alright, I'm just going to get my stuff all set up. Okay, so I'm going to grab my suction catheter here from the wall. For adults, we want 100 to 120 on the suction level. For pediatrics, it's up 80 to 100, and you want to make sure that the suction is actually set to continuous. Okay, so it's always applying pressure for us. Okay, now I'm going to set up my field. I'm going to take the drape, place it over Mr. Jones's chest. Put this across you, Mr. Jones, so we don't make a mess. Okay, and now I'm going to prepare my field. We want to open up the suction catheter. And now we're going to open up our trach care kit. And remember, everything inside the trach care kit is sterile. Apply my sterile gloves. my gauze. There's two different types of gauze in here. I've got regular 4x4s and the drain sponges with the slit in it that's going to go around the trach when I'm finished. Got the trach ties. Got our normal saline solution. Packages of hydrogen peroxide, pipe cleaner, and cotton tip applicators. Okay, I'm going to open up the saline now. Doing okay there, Mr. Jones? Okay, good. I'm looking at my pulse ox. I'm going to open this up. I'm going to pour 50% of the saline into the large compartment, and then the other 50% between the other two compartments. So 25 and 25 here. Okay. Then I've got my hydrogen peroxide. Now we're going to put that in with the 50% saline. So you're going to have a solution of 50 hydrogen peroxide, 50 saline. Okay. Now I'm going to remove the inner cannula from the patient. I'm going to keep one hand sterile, and I've got one hand. Always want your sterile hand to be your dominant hand. I'm going to unlock the trach cannula. Okay, Mr. Jones, take some deep breaths here. I'm just removing your inner cannula. I'm going to clean it. Put that in the 50-50 solution. Okay, now we're going to let that marinate for a little bit. And I'm going to grab my suction catheter and I'm going to prepare to suction the patient. Now it's important that once I start suctioning that I'm always keeping my left hand, which is my dominant hand, sterile, and my right hand clean. Okay, I'm going to attach the two together. Okay, I want to prime my suction catheter with the normal saline. Okay, all right, Mr. Jones, I'm going to go ahead and suction you. Go ahead and take some nice deep breaths. Okay, good. Great color. And now I'm going to go ahead and apply suction. Now, remember, we're not applying suction as we go down, but on the way back up. So I'm going to insert the catheter. I feel a little bit of resistance. Going to suction as I'm coming up with some circles. Okay, I want to apply the oxygen again. I'm going to clear my catheter. Okay, Mr. Jones, it sounds like we've got a little bit of secretion still in there, so we're going to suction again. Take some deep breaths for me. Okay, good. Alright, here we go. Feel a little bit of resistance, then suction. Okay, reapply the oxygen. Clear our catheter. Okay, and we always want to be assessing what our secretions look like, the thickness and the color. Now I can go ahead and separate my two suction devices. Look at this. Now I'm going to clean the inner cannula. So remember, it's sitting here in the 50-50 solution. We're going to take the pipe cleaner and we're going to get all this gunk out of the inner cannula here.
The neck cannula, guys.
So
That's
make
the one
sure your
to
clean hand is only
vision
holding
cleaner.
on to the top part of the inner cannula. Okay. Good. Now we're going to rinse it in the other saline solution. Good. And then we want to make sure it's dry because remember, this is going back into the patient's airway. Mr. Jones. Now I'm going to continue with my trach here. We're just going to clean up around the side a little bit and change your gauze. going to change the trach ties. Now this is where it's nice to have a partner, but if not, it can be done individually. Take the tie now. Here, get this around your neck. Okay? You never want to loosen the trach ties before you have new ties in cap unless you have another person here to hold it for you. You don't want this trach to become dislodged. Okay, now I'm going to untie this side and remove the old ties. Now I'll apply the clean gauze. This is to catch any secretions if the patient happens to cough up on their own. Alright, and then you also want to make sure that the trach ties are about 1 finger's width so that they're not too tight but tight enough to keep the trach in place. Okay, reapply the oxygen. Doing okay there, Mr. Jones? Okay, good. I'm going to reassess now. Listen for my lung sounds again. Take some deep breaths for me. Again. 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 Okay, sounds much better. And then let's look at what your pulse ox is reading. Your pulse ox is much better. It's up to 97%. That's good. Okay, Mr. Jones, I'm finished with what I needed to do. Is there anything else I can get for you right now? I'm just going to clean up my area here. Lower the bed. You have your call light right by you. Check on you, Mr. Jones. Push your call light if you need anything.
Alright, so I do hope you learned something from this video. And stay safe, everyone. Protect yourself against the COVID-19. My name is Len Paulo Sivasigna. I am a student nurse. I hope that we can see each other soon. Take care and bye-bye.